Hi everyone and dear parents, I am Dr. Beena Johnson, developmental pediatrician and senior consultant in child guidance. This video explains the essential features of attention deficit hyperactivity disorder or ADHD in young children, which every parent should be aware of. We know that many children may be inattentive, impulsive and hyperactive at times. But for a diagnosis of ADHD, these symptoms must interfere significantly in different places, such as at school and also at home. The symptoms usually start in preschool age. The features should be present for at least 6 months to diagnose ADHD. Population surveys have shown that ADHD occurs in most cultures in about 5% of children. Attention deficit hyperactivity disorder is a developmental disorder, and children with ADHD have developmentally inappropriate levels of inattention and/or hyperactivity-impulsivity. The main features of ADHD are persistent patterns of inattention and/or hyperactivity-impulsivity that interferes with the quality of social and academic functioning of the child. Remember to subscribe this channel. Press the bell icon to get all the updates from the channel Best Child Development and Parenting. ADHD is associated with significant impairment in behavioral, social, pre-academic and academic functioning of children. It typically begins early in life at young age and will persist into elementary school with negative impact that can persist beyond adolescence into adulthood if not intervened at the earliest. The most important features of inattention are the following: getting easily distracted by extraneous stimuli, making careless mistakes in schoolwork, having difficulty in maintaining attention even in play activities, often losing things like toys, books, pencils or school bag, and these children are often forgetful in daily activities. The most important features of hyperactivity are often manifested by fidgeting with hands or feet. These children often leave the seat in situations where remaining seated is expected. For example, leaving the seat and running about in classroom while the teacher is taking class. Children with ADHD also talk excessively and run about excessively. Children with ADHD often show impulsive behavior characterized by blurting out answers, interrupting others during conversation, and having difficulty awaiting turn. There are 3 different types of ADHD depending on which type of features are strongest in the individual. First is predominantly inattentive presentation. Second is predominantly hyperactive impulsive presentation, and the third is a combined presentation. And in the third type, the features of inattention, hyperactivity and impulsive behavior are present in the child. Girls tend to have more of inattentive symptoms and boys usually have hyperactive impulsive symptoms. How to manage ADHD in young children less than 6 years of age? Behavioral interventions are very effective for improving a child's behavior during young age. Initially, detailed behavioral assessment of the child is done, and behavioral assessment consists of analysis of the behavior problems and its causes, and we identify the target behaviors to be modified. We know that parents have the greatest influence in modifying a young child's behavior. Young children cannot change their behavior themselves. Hence, parent training interventions are essential in the management of young children with ADHD, and several scientific studies have proved the effectiveness of these interventions. Parents are taught the strategies for modifying the inattention, hyperactivity and impulsivity of children with ADHD. The strategies for positive ways of interaction and communication with a child are also taught. Activities are designed for parents to be practiced at home. The progress is monitored regularly and training is provided to the parents. Re-evaluation of the treatment plans are done at regular intervals and strategies are adjusted according to the situation, and it has long-lasting benefits for the child and the parents. Early interventions should be provided for all the young children with ADHD during preschool age. Parent training intervention is recommended as the first-line treatment for attention deficit hyperactivity disorder in young children. Best wishes to all parents. Thank you all. Kindly subscribe this channel for future updates on best child development and parenting.